Namaskar, a warm welcome to World News and Indian Perspective on All India Radio. This is Anita Anand and with me is R.S. Raghu, bringing glimpses of the major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment and more. The headlines. Defence Minister Rajnath Singh reviews preparedness as armed forces assist civilians in fight against coronavirus pandemic. 7 Indian naval ships deployed for shipment of liquid medical oxygen, filled cryogenic containers and medical equipment from various countries. COVID-19 vaccination drive for the age of 18 years and above begins in India. Final phase of pullout of US forces begins in Afghanistan. Over 15 crore 49 lakh doses of COVID-19 vaccine administered in India so far. First batch of Russian COVID-19 vaccine Sputnik 5 arrives in the country. Lockdown in Delhi extended by 1 week. And in IPL cricket, Mumbai Indians take on Chennai Super Kings in Delhi. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the person aged between 18 and 44 began today at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Defence Minister Rajnath Singh has reiterated that the armed forces should provide all necessary assistance to civilian administration and asked the officials of the Defence Ministry and the 3 services to closely monitor the progress of various initiatives. Mr. Singh on Saturday reviewed the efforts and preparedness of armed forces and Ministry of Defence in strengthening India's fight against COVID-19 pandemic through video conferencing. Mr. Singh was briefed that approximately 600 additional doctors are being mobilized through special measures such as calling to duty those who had retired in the last few years. The Indian Navy has deployed 200 battlefield nursing assistants to assist in various hospitals. The National Cadet Corps NCC has deployed 300 cadets and staff at various locations in Maharashtra, Uttarakhand and Haryana. A telemedicine service to be operated by health veterans will begin soon to provide consultation to those patients who remain at home. Indian Army has made available more than 720 beds for civilians in various states. The Defence Minister directed the Army to share the details with local administration at the state and district levels. Chief of Defence Staff General Bipin Rawat suggested that local military commands have to be actively engaged in assisting the civil administration. Mr. Singh was briefed at the 500-bed hospital being set up by DRDO in Lucknow will start functioning in the next 2 to 3 days. Another hospital is also being set up at Varanasi, which is scheduled to be completed by 5th of this month. DRDO Chairman Dr. G. Satish Reddy said the first 4 out of 380 oxygen pressure swing absorption PSA plants being manufactured under PM CARES Fund will be deployed in hospitals in New Delhi by next week. Mr. Singh appreciated the logistics support being provided by the armed forces in transporting oxygen containers from abroad as well as within the country between places of consumption and production. While transport aircraft of the Indian Air Force IAF carried out several sorties from Singapore, Bangkok, Dubai and within the country, Indian Navy dispatched 4 ships, 2 to West Asia and 2 to Southeast Asia to transport filled oxygen containers to India. As of today, IAF carried out 28 sorties from abroad, airlifting 47 oxygen containers with 830 metric tons of capacity, while from within the country it carried out 158 sorties, airlifting 109 containers with 2,271 metric tons capacity. The Navy and the Air Force have also supplied nearly 500 portable oxygen cylinders from their stores to various civilian hospitals. Defence public sector undertakings are procuring 28 oxygen plants and other medical equipment worth 40 crore rupees under corporate social responsibility for supplying to various hospitals in states. Hindustan Aeronautics Limited has set up a 250-bed hospital in Bengaluru. Another 250-bed hospital is being set up in Lucknow. The meeting was attended by Defence Secretary Dr. Ajay Kumar, Navy Chief Admiral Karambir Singh, Air Force Chief Air Chief Marshal R.K.S. Bhadoria, Army Chief General M.M. Naravane, and Director General Armed Forces Medical Services Surgeon Vice Admiral Rajat Datta, including other senior officials.
In support of the nation's fight against COVID-19 and as part of Operation Samudra Setu 2, 7 Indian naval ships including Kolkata, Kochi, Talwar, Tabar, Trikand, Jalashwa and Aeronautics have been deployed for shipment of liquid medical oxygen-filled cryogenic containers and associated medical equipment from various countries. INS Kolkata and INS Talwar mission deployed in Persian Gulf were the first batch of ships that were immediately diverted for the task and entered port of Manama, Bahrain on 30th of April this year. INS Talwar with 40 metric ton liquid medical oxygen has commenced its journey back to India. INS Kolkata has proceeded to Doha, Qatar for embarking medical supplies and will subsequently head to Kuwait for embarking liquid oxygen tanks. In the first phase of Operation Samudra Setu, which was launched last year by the Navy, around 4,000 Indian citizens stranded in neighbouring countries amidst COVID-19 outbreak were successfully repatriated to India. The Government of India on Saturday said that 30 industries have been identified in the country where existing nitrogen manufacturing plants will be converted into oxygen manufacturing plants. Environment Ministry has said that considering the COVID-19 pandemic situation and to further augment availability of oxygen for medical purposes in the country, the central government had asked Central Pollution Control Board CPCB to identify the industries having spare nitrogen plants and explore the feasibility of converting of existing nitrogen plants to produce oxygen. CPCB, with the help of state pollution control boards, have identified 30 such industries wherein existing nitrogen generation plants may be spared for production of oxygen. The ministry said efforts have begun to modify nitrogen plants for the production of medical oxygen. Some of these plants can be shifted to nearby hospitals for supplying oxygen.
The first consignment of Russia-made Sputnik 5 vaccine arrived at the Samshabad International Airport in Hyderabad this evening by a special flight. As part of the first lot, 150,000 vaccines have reached. This is the third vaccine which will be used as a preventive vaccine against coronavirus in India, and the Drug Controller General of India had recently approved emergency use of Sputnik 5 COVID-19 vaccine. The first consignment has been handed over to Indian partner of the Russian vaccine, Dr. Reddy's Laboratories. India has said that the arrival of the Russian COVID vaccine Sputnik 5 will further augment country's vaccine capacity and will also accelerate its vaccination drive. Spokesperson in the Ministry of External Affairs, Arindam Bagchi, has said that the Russian vaccine will add to the country's arsenal to fight out the pandemic. He informed that 150,000 doses of the vaccine have been received in today's consignment. Mr. Bagchi added that the other larger consignments will arrive soon. Highlighting more than a decade-long India-Russia special and privileged strategic partnership, the spokesperson also informed of the plans to manufacture the Russian vaccine in the country on large scales. India has administered over 49 lakh doses of COVID-19 vaccine in the country so far. These include over 94 lakh healthcare workers who have taken the first dose and more than 62 lakh healthcare workers who have taken the second dose. Over 1,25 lakh frontline workers have taken the first dose and more than 68 lakh frontline workers have taken the second dose. India had launched the world's largest vaccination drive on 16th of January this year. Meanwhile, Delhi Chief Minister Arvind Kejriwal on Saturday announced that lockdown in the national capital is being extended by 1 week. On 19th of April, Delhi government had decided to put the city under a week-long lockdown, which was later extended till 3rd of May. Delhi recorded over 27,000 new cases and 375 deaths in the last 24 hours. For the 13th straight day, the city has reported more than 20,000 cases per day.
Russia's ambassador to India, Niloke Kodashev, expressed happiness on the arrival of the first batch of Russian COVID vaccine, Sputnik V, in India today. In his message, the ambassador said that as both Russia and India continue dedicated joint efforts to combat the COVID-19 pandemic, the arrival of Sputnik V is important to support India's endeavors to mitigate the second wave of COVID and save lives. Mr. Kodashe asserted that the efficacy of the Sputnik vaccine is among the highest in the world and will also be effective against new strains of COVID-19. He informed that its local production in India will commence soon and is planned to be gradually increased up to 850 million doses per year. Indian Embassy in China is coordinating with local agencies to facilitate transport and logistics of emergency supplies to India procured commercially by Indian companies. Indian Embassy in a tweet said today that 12 ISO containers for transporting liquid medical oxygen have been sent from Tianjin to India by Russian airlines Volga-Dnepr, which was procured commercially by an Indian company. Throughout this past week, China has expressed its willingness to offer assistance to India to tackle the COVID situation. On Friday, Chinese President Xi Jinping sent a message to Prime Minister Narendra Modi and offered cooperation in dealing with the situation created by COVID-19. She said, China is willing to strengthen anti-pandemic cooperation with India and provide support and help the country, China's state news agency reported. Late in the evening on Friday, External Affairs Minister Dr. S. Jaishankar had a phone conversation with the State Councillor and Foreign Minister of China, Mr. Wang Yi, at the request of the Chinese side to convey their sympathy and solidarity with India at this juncture. Dr. Jaishankar highlighted in this regard that Indian entities were already in the process of commercially procuring required products and raw materials from suppliers in China. The minister said that this process would be facilitated if various transport corridors and cargo flights remained open and the necessary logistics support ensured expeditiously. The messages from President Xi and Foreign Minister Wang Yi came even as the militaries of the two countries are yet to resolve the disengagement from the remaining areas of eastern Ladakh after the withdrawal from Pangong Lake area in February. The two ministers also discussed the outstanding issues related to disengagement from all friction points along the line of actual control LAC in eastern Ladakh.
This is All India Radio giving you the world news.
3 steps to stay protected and stay safe from COVID-19. Wear face mask, 2 gaz ki duri to maintain social distancing, maintain hand and face hygiene.
In today's Hotspot section, we are taking a closer look at the third phase of the world's largest vaccination drive. Starting today, India will deliver vaccination to all adults between the age of 18 to 45. In conversation are Professor Anjan Trikha, who is in charge of the COVID Care and Vaccination Center at AIIMS, Delhi, and Anand Chaturvedi, AIR correspondent.
First question, Dr. Trikha, about vaccination. I took my first dose of vaccine, had symptoms after some weeks. Can I take my second dose of vaccine at the time prescribed after the first dose?
If you have taken a first dose of vaccine and then you have got infected and then you had tested positive and now you have come out of the COVID infection, so you should take the second dose of vaccine at least 4 weeks after you have become asymptomatic. Some people say even 6 weeks, but anything between 4 to 6 weeks after you have come out of the COVID infection.
I am 19 years old. Where can I get the vaccine? Can I get at government hospital or at any private hospital? How much will it cost?
See, you can get it at the government hospital. It will be free for all the citizens of the country. And you can go to the private hospital where the cost would be very minimal. I think it should be about 650 rupees or 700 rupees, depending upon which vaccine is available at the private setup. But I suggest you go to the government hospitals where it is not going to cost you.
Where and when to get registered for my COVID vaccination?
To get registered for your COVID vaccination, you can go to the app for the COVID vaccination and you can easily get registered. If you are not computer savvy, you can go to your friend or any other person in your area who's computer savvy and he can get you registered, and then you would be given a slot and then you can get it done. If you don't even have that, you can go to any shop which has a computer or who deals in mobile phones or from where you book your tickets, railway tickets. There are so many people like this in the market. They can get you registered on the net and they will not charge you anything.
How will the vaccine be useful for me?
The vaccine will be very useful for you. The first thing is that if you have taken the vaccine, both the shots as per government advisories, and you have developed antibodies, the possibility is that you may not contract the disease, and if at all you get COVID infection, the severity of the disease will be tremendously less. So maybe you would have never to be hospitalized, you will never get that sick, and it's very unlikely that you will ever needing to go on a ventilator.
Are there any side effects of the vaccine?
See, any injections, any vaccines would have side effects, which are very rare and government is monitoring them. The most common side effects are some pain and soreness at the point of injection. Then you could have some mild fever or some rash. And it is nothing very serious or significant. If you have anything more than that, the government is keeping a strict watch on these symptoms and these problems. You should go back to the place, or there is a phone number available. You could phone them up and they will advise you free of cost and tell you what to do and even tell you where to go to the nearest hospital if you have very serious side effects.
By what time can I expect full protection after taking the vaccine?
See, 100% protection from any vaccine for any disease in the world is not possible. It's only the efficacy or the efficiency of any vaccine which is important. So quite a large number of people would have protection against a disease after they've taken the vaccine as per standard guidelines, and the same thing holds good for COVID-19 vaccination also. So about 2 to 3 weeks after the second dose, ideally 2 weeks, you should have enough of antibodies which are likely to protect you from getting any serious COVID infection.
Can I go out to work after being vaccinated and with the masks on and maintaining social distancing, of course? Am I likely to lose my daily wages for some days?
See, the first thing is you can go to work with mask and social distancing after you've had your vaccinations, provided there are no guidelines or lockdowns or curfews in your area, and you'll have to follow them and follow all those rules by the government. The second thing is, it's also the government has made it very clear that nobody will lose jobs if you are in a government setup, if you are ill or you have been taken down by infection of COVID-19.
Is it mandatory to have COVID-appropriate behavior everywhere?
Yes, it is mandatory, it is essential, and I go a step ahead. It is as essential as you wear your clothes. You wear your clothes when you go out to work. You wear your clothes when you are in your house. So all things which are done in a COVID-appropriate behavior should be as essential as clothes on your body, anywhere and everywhere.
Is there a likelihood of getting some gynecological problems with vaccination?
See, it's unlikely that you can get a gynecological problem after vaccination. No, it's not possible. Or if there is a side effect of any which may be very rare, but that is not heard of. We've never seen it so far.
Actually, doctor, this question was pertaining to some myth about the women who are menstruating like 5 days before or after. There are some messages doing rounds that they should avoid taking that.
There is no government guideline which says that women who are menstruating or having their periods should not get their jabs. But then what is important is it is free of cost.
The next question is about what I should do to not get infected from COVID-19.
See, as an individual, if you want to protect yourself from getting infected from COVID-19, you should remain inside your house. Don't leave your house unless totally essential. If you have to go out for whatever reasons, you should be wearing a mask and you should be maintaining distances. And when you come back, again, you should wash your hands and wash your face before you really eat or drink anything. So you maintain all the sterility possible in your house itself. wear masks because there could be some asymptomatic carriers in your house, and try to remain in isolation as far as possible. I can very well understand that many people may not have so much of space in their houses, so it is important for even those places, those people to wear masks in the house.
What I should do if I am infected and asymptomatic?
See, if you are infected and you are asymptomatic, that means you have a test which is positive and somebody has told you to do a test for whatever reasons. So if you are infected and you are asymptomatic, so you have to see for yourself that you don't spread it to other people. So you go into isolation, do not sit with your friends or co-workers to eat food or to have tea or anything else, or sit together and watch a TV on the same sofa or something like that. Remain isolated in your room and stop going to your office or your place of work.
What I should do if I'm infected and symptomatic for last 3 to 5 days when I have only fever or when I have fever, cough and cold?
See, if you are infected and you have any kind of symptoms, you have named symptoms like fever and cough, so you should be on regular medications as per the doctor to take care of your fever round the clock, and you could be having some kind of a cough syrup so that your cough is suppressed and that doesn't cause you much of a problem. At the same time, after you have taken care of this fever and cough, you should remain isolated in a room and not interact with other people.
Home isolation or hospitalization? When and how?
See, home isolation, the primary way you can do it if you have a big enough house. If you have 2-bedroom flat and you have 5 people to live in it, I can very well imagine and understand that home isolation is difficult. So then you can go into a COVID care center and not a hospital. There are COVID care centers which have been made by the government all over where people can go and be isolated from their family members. If you have a big house and you are symptomatic and you can stay in a room with a toilet, bathroom and take care of yourself, then you should be isolating in your house. You should only move to a hospital if your oxygen is dipping in your blood, if you are aware of a saturation, a pulse oximeter. If you are not, if you get symptoms, if you feel breathless, then you should consult a doctor and be moved to a hospital.
How to improve my oxygen saturation and what is pronal breathing?
See, it is your oxygen saturation can improve if you can do some respiratory exercises or pulmonary exercises. And it is not pronal respiration. It is lying in the prone position and trying to take deep breaths when you lie flat on your stomach and not on your back. When you lie on your stomach and breathe, there are some people who can even sleep like this or who have a habit of sleeping like this. Then that parts of your lung get ventilated, or when you breathe, air goes to that part of the lungs which are not really full of air when you lie on your back. So when you lie prone, which is on your stomach, and you lie like this for some time, that is known as prone position breathing or prone ventilation or conscious proning ventilation.
COVID testing is taking some time nowadays. What should I do about this in case I feel I'm infected?
See, we all know that it may take up to 1 day in a metropolitan city or maybe more, or maybe 3 to 4 days in a smaller city to get a report of a RT-PCR. If you think you are positive, you've given your test, the best way is to isolate yourself and consider that you are infective. You can pass on the virus to others and you are positive unless proven otherwise.
Is there any prophylactic medication to avoid contracting the virus?
See, there were a lot of issues regarding prophylactic medications to avoid getting infected by coronavirus. However, in the last 14 months, the evidence is very bleak or not at all regarding any other medications which you can take and you can avoid contracting or getting COVID-19 virus. Initially, there was a big usage of hydroxychloroquine, but now over the years, over the last 15 months, its use as a prophylactic medication is basically zero.
Is it required for people at home to put on masks?
Yes, this is one of the latest guidelines which has been released by the government and the NITI Aayog yesterday only. because there are a lot of asymptomatic infected carriers in the society. So it is advisable that you remain wearing a mask in the home so that you can avoid getting infected. It is equally important that when you have household help coming into your houses, they should be wearing a mask and you should be also wearing a mask.
What is double masking? How to do it, and is it mandatory?
Double masking is, as the word tells you, that you wear one mask and you wear the other mask over it, so that every part of your nose and the face and the cheek is covered, and it prevents any kind of infected air getting into your nose and mouth. It will be difficult to describe the way you do it on audio device, but there are enough of photographs available in the newspaper which tell you how to go about doing it. If you wear double mask, it is known as double masking, the chances of you getting infected from another person or because of airborne aerosols full of virus is decreased tremendously.
Thank you so much, Doctor.
The final phase of pullout by the US in Afghanistan formally began on Saturday, 20 years after the US forces first entered the country. President Joe Biden had set May the 1st as the official start of the withdrawal of the remaining forces. Even before Saturday, the Herculean task of packing up had begun. The military has been taking inventory and the military has been flying out equipment on massive C-17 cargo planes. In IPL cricket, chasing a target of 219 runs, Mumbai Indians were 130 for 3 in 14 overs against Chennai Super Kings at Arun Jaitley Stadium in New Delhi when reports last came in. Put into bat first, Chennai posted a huge 218 runs for 4 wickets in the stipulated 20 overs, riding on Ambati Rayudu's unbeaten knock of 72 in just 27 balls and Moeen Ali's 58 of 36 and Faf du Plessis' 50 of 28. For Mumbai, Kieran Pollard picked up 2 wickets while Trent Boult and Jasprit Bumrah took 1 wicket each.
And now let us take a look at the major developments around the world as reported in the foreign press. The Telegraph reports that in the past week, 41% of all COVID deaths happened in the Americas, which is home to around 13% of the world's population. The South China Morning Post reports that Kyrgyz-Tajik leaders step in to save ceasefire after border clashes leave 33 dead. New York Times writes on how the second dose of a COVID-19 vaccine gives more protection than it might be thought and why one should get it. The Globe and Mail write that Atlantic Canada's strict quarantine rules come under increasing scrutiny as region grapples with third wave. And The Guardian writes that Salman Rushdie and Bernardine Evaristo are on shortlist for more diverse UK exam tests. And a quick look at the headlines once again. Defence Minister Rajnath Singh reviews preparedness as armed forces assist civilians in fight against coronavirus pandemic. 7 Indian naval ships deployed for shipment of liquid medical oxygen, filled cryogenic containers and medical equipment from various countries. COVID-19 vaccination drive for the age of 18 years and above begins in India. Final phase of pullout of US forces begins in Afghanistan. Over 15 crore 49 lakh doses of COVID-19 vaccine administered in India so far. First batch of Russian COVID-19 vaccine Sputnik 5 arrives in the country. Lockdown in Delhi extended by 1 week, and in IPL cricket, Mumbai Indians take on Chennai Super Kings in Delhi. India is celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let us listen to his favorite bhajan, Vaishnav Jan, by artists from Bahrain. Vaishnav Jan to tene kahiye se pid parai jani re hari suke upkar kare toye mane abhimani nani re Vaishnav Jan to tene kahiye se pid parai jani re. And with that we end this bulletin. We'll be back at the same time tomorrow with the next edition of World News.